So digging right in, managed care organizations. This chapter, the outcomes include define the different types of managed care plans, explain the difference between the types, identify and explain cost controls utilized by these healthcare plans, explain contract management, financing, incentive tools, the functions of the National Committee of Quality Assurance and that impact they have, identify the purpose and goals of the healthcare effectiveness data and information set, and then describe the components of Medicare managed care and how they impact the Medicare beneficiary. Whew. So chapter 6, the intro starts page 103. Purpose of managed care is to provide quality and affordable health care to the plan beneficiaries. That would be us, the consumers. So this entire chapter, or honestly even the chapter before, it's all about quality and affordable. That's where we are at with healthcare, financing healthcare, paying for healthcare. There are people in offices in Congress or lawmakers or providers or nurses, somebody somewhere out there is trying to make all of this improved and affordable for all of us, which is great. It's going to take some time to get there though, I believe. Okay, moving on. Next page talks about health maintenance organizations. HMO is a voluntary health plan that will provide healthcare services to its member in return for a monthly premium. That's generally what most of us have. That's the traditional, typical offered by an employer. You can buy that on the marketplace. That's a HMO. Now the chapter digs into a little bit deeper. There's group model HMOs, independent practice associations, network model HMOs, and staff model HMOs. And staff model, the HMO will directly employ the physicians and various other healthcare professionals to provide healthcare services to their members. I'm trying to think of an example for that, and it used to be Kaiser, I believe, would have been a staff model HMO. You went and saw Kaiser doctors as a Kaiser healthcare consumer. And honestly, that was a long time ago. So anyways, this little side note there. What else? Sorry, I got sidetracked. PPOs, that this is considered to be a large group of hospitals or physicians that are under contract to serve members of a managed care plan. So that's another type of HMO. POS, point of service plan, is similar to HMO in that the subscriber must select the physician to be what is referred to as the primary care for a patient. So did you know that primary care providers can be physicians, family physicians, pediatricians, an internist, OBGYN doctor, and even now, because that was quoted from back in 2014, even today, 2020, a nurse practitioner or even a physician assistant can be a primary care provider. Exclusive provider organizations, EPOs, are similar to PPO, except that the patients enrolled in the plan are to receive healthcare services only from an EPO network provider. So lots of similarities with these, but lots of differences all at the same time. Let me see if the chapter has a good list or chart. It does not. So you guys, you may want to write these out or take notes as you read along, or highlight the book if you have it, just to keep up with the little differences. IDS is integrated delivery systems. So most IDSs are comprised of multiple facilities that can provide care along the continuum of care for the patient and their family. It consists of physicians' offices, ambulatory centers, surgery centers, outpatient clinics, acute care facilities. Now, what the IDS does not mention here is skilled nursing facilities. So pay close attention to that. Okay, keeping right on, I'm on page 107 now, managed care cost control. Several ways that managed care plans will look to contain cost all while maintaining quality. Again, quality and lower cost. Medical necessity. The American College of Medical Quality has defined medical necessity as accepted healthcare services and supplies provided by healthcare entities, appropriate to the evaluation and treatment of disease, condition, illness, injury, and consistent with applicable standard of care. And that is pretty, even though that is from a source that's 10 years old, that's pretty standard today. Medical necessity is important. If you watch any kind of medical shows on TV in your spare time, you'll notice, a year or two ago, a lot of the shows talked about not wanting to order MRIs or not wanting to order CAT scans because it wasn't medically necessary. And that's what this comes down to. So medical necessity has to be proven when you're spending money in the healthcare realm. Proven to consumers, as a consumer, why did you order that $2,000 test for me? And also from the healthcare insurance providers, the offices who receive that bill from a health insurance office, they're going to want to know why a physician or a doctor or PA or nurse practitioner ordered that $2,000 test also. So it's a collaborative effort to lower costs and maintain that quality. Utilization review is next. Utilization management is defined as the evaluation of the medical necessity, appropriateness, and efficiency of the use of healthcare services, procedures, etc. Again, going back to what I just said, it's a collaborative effort. Prior authorization. We've talked about prior authorization in prior chapters, and not all tests, procedures, visits require that, but some do, especially in the world of dentistry. I believe every single dentist, anything that I've had to have prior authorization. That's not exactly so with health insurance. A little different there. But you have to read your individual plan very carefully. Some things may require prior authorization. Case management. Case management is an entirely a very vast career. In case managing as a career, you have doctors, social workers, nurses, and I'm sure all kinds of admin people also. I'm sure there's more healthcare workers that do case management, but that is a very large career choice and function modality, if you will, to just be in 4 paragraphs of this chapter. But anyway, case management is defined by the Case Management Society of America as a collaborative process of assessment, planning, facilitation, care coordination, evaluation, and advocacy of options and services to meet an individual and family's comprehensive health needs through communication and available resources to promote quality, cost-effective outcomes. Again, quality and money, very important in this chapter. And actually, that's the whole point of this entire class. So you're going to hear that a lot. I'm going to keep on reading. Prescription management. There's all kinds of formularies, and sometimes prescriptions do require prior authorization, whether it's from a doctor, whether it's from the pharmacy, whether it's from your insurance company. So that's something to know. And moving right along, contract management and financial incentives. Capitation is a type of payment that is not based on a specific procedure or hospital stay, as it's based on a per member per month methodology. In the managed care environment, this plan will negotiate with a large group employer or government agency in contracts to cover the agreed upon population and provide all contracted services listed in the agreement for a set monthly fee per member. As a nurse, I am not familiar with this plan or option as much. But just that's basically what you need to know about it. It's there. So if you ever hear that word again, you can say, I remember that from my HEA 135 class. Global payment is explained, financial incentives, contract management. Significant part of the EOC payment method, and it requires that providers of care along with the plans be as precise as possible in projecting expenditures in order to negotiate a contract. So the preciseness when it comes to contract management is what's important to remember. National Committee of Quality Assurance. There's an entire committee, you guys, identified by the Department of Health and Human Resources. So again, more people looking at quality and trying to save us money. The National Committee for Quality Assurance offers recognition programs that focus on the employers, health plans, patients, and consumers to allow them to make informed healthcare decisions based on quality. Very important there. We want to be able to make our own decisions. Okay, healthcare effectiveness data and information set. As part of that group from the National Committee for Quality Assurance, you can read about that. Medicare Managed Care. I told you we would always talk about Medicare. This is part of that 1997 Budget Act. You can read that. CCPs, Coordinated Care Plans, include a network of providers that are under a contractual agreement to deliver the benefits package that is approved by CMS, Centers of Medicaid and Medicare Services. CMS is something you are going to know about and hear about and learn about for the rest of your career if you decide to stay in healthcare finance. They are truly one of probably the biggest governing bodies for our healthcare finance. But anyway, it includes a network of providers that are under an agreement or an arrangement. HMO is listed again, POS. This is all about the coordinated care plan, the different options. You guys I'm not going to read that to you. Special needs plans, Medicare Advantage plan that meets all the requirements, offers Part D prescriptions. So the special needs plan, it targets special individuals, whether this is somebody with special needs, institutionalized people, high-risk people. You're going to want to know what the special needs plan, what they do, or who they offer it to especially. It's unique. Medical savings account plans. Those of us who work for larger employers are familiar with these, and they're excellent. They come in many different shapes and sizes. The Medicare medical spending account combines a high deductible plan and a medical savings discount that is used to pay for those qualified medical expenses. Typically, that money that is put in these type of savings account plans for healthcare is pre-tax, so you do not owe any tax on that money. So there's benefits there too, an incentive, if you will, for folks to elect into that type of plan. You're not taxed on that money. Private fee-for-service plans, that's a great paragraph you can read. Employer group health plan is a group plan that is sponsored by an employer or labor organization. The employer and union can sponsor a group by enrolling their members in one of 3 options. And it's restricted to individuals who are beneficiaries. Okay. Most important thing there is that there are 3 options to that employer group health plan. And this is something I did not know. Religious fraternal benefits plan. So there is actually a health insurance plan for if you're part of a fraternity society. Only members can be a part of that. And there's an Internal Revenue Code from 1986 that is affiliated with that. So that was news to me. And then we come to the conclusion of this chapter. Managed care programs, what they do. Healthcare professionals need to understand better the entities that oversee these managed care organizations. And honestly, healthcare consumers need to understand that better too. So that's it for chapter 6. If you guys have any questions about anything, do not hesitate to outreach me. Thanks.